you're welcome back to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki, okay? So, have you subscribed to my YouTube channel? Please run, subscribe to my YouTube channel, and the handle is called Health Talk Queen 1. Health Talk Queen 1. Like, share, subscribe, and turn on your post notifications so you can get notified when I drop a new video. Okay, so now what's today's topic? Today's topic is the big one. I've been wanting to do this topic for so long, but I was like keeping, because it's too big. I can't use 2 videos to explain the disease process, but I will try as much as possible to do 2 parts. It's going to be part 1 and part 2. I hope I will be able to cover as much as I can. So this topic is one of the topics that people message me a lot to do, and I've received a lot. So I'm bringing it to you guys. Okay, so the topic is how to prevent diabetes. What do we need to know about diabetes? So here we go. Let's go into it. So what is diabetes? Diabetes is a group of disease that result in too much sugar in our blood. If you have high blood sugar, glucose in your system, then you definitely have diabetes. So now, to diagnose diabetes is not one-time thing. Like I always say, it's thing that you have to discuss with your healthcare provider. They have to do lab, because I did a video about yearly physical tests that we need to do. Part of it is checking our cholesterol level, and then most of the results, usually if you have diabetes or you're about to have pre-diabetes, your lab result will show. That's why it is important that we do that yearly, and I have a video for that. Please check it out on my previous video on YouTube. You will see it. So that's why it's very important for us to do that yearly. So that way, if we have diabetes, they can diagnose us for that. Now, in all my program, I always say health is wealth. Prevention is what I'm going to be talking about, So that's why I am going to go into it. I'm not going to talk about the disease process. I'm not going to talk about the pathophysiology. No, we don't need that. We only need the prevention, the signs and symptoms. Sometimes I will do the causes of this disease process. So let's go to, we have various type of diabetes. We have type 1, type 2, pre-diabetes, and gestational diabetes. I'm going to read it off what I wrote down, because I did my research, and as a nurse, I'm going to be teaching you what I wrote down when it comes to this 4 type of diabetes. The first one, type 1, is a lifelong condition where the pancreas make little or no insulin, which leads to high blood sugar level. That's type 1. Type 2, a long-term condition in which the body has trouble controlling the blood sugar and using it for energy. The next one, which is the pre-diabetes, is a blood sugar level that is higher than what is considered healthy, but not high enough to be type 2. The last one, which is gestational diabetes, the condition that is the blood sugar is high during pregnancy. That's the definition of type 1, type 2, type 3, and type 1, type 2, pre-diabetes, and gestational diabetes. Okay, now what are the causes of diabetes? We can have different causes, and this varies from individual. It's not only they can have 1 or 2, but it varies from individual. You can have family history of diabetes, can cause diabetes, maybe lack of diet, not eating properly, inactivity, you're not exercising, age, if you have hypertension, if you have maybe pre-existing diabetes that you don't even know, so, and some certain medication. So now let's go to signs and symptoms, which I love. Now this is where I'm gonna be talking more, so this is gonna be part 1. Please watch out for part 2 immediately after this one end. So what are the signs of diabetes? What are the signs? What when we see it, we will know that yes, this person has diabetes. As a nurse and nursing student, this video is very good for you guys. We have what we call 3 P's: polyuria, polydipsia, and polyaphasia. And I'm going to be discussing, I will break the term down so for non-nurses to understand. Okay, so if you have this following sign, seek for medical attention. Please seek for medical help, please, immediately. Sometimes patients with diabetes, they have signs of feeling more thirsty. They drink water a lot. When I say a lot, it's not just drinking water because you're thirsty. They drink a lot. They urinate frequently. They go to the bathroom frequently. They have weight loss without even exercising, severe weight loss. They eat a lot. That's why I said the 3 P: polyuria, polydipsia, and polyaphasia. They feel tired and weak. They have blurry vision sometimes. They also have sore that is really, really difficult to heal. They have ketone in their urine. Sometimes when they go to do their physical, they get ketone in their urine. They also eat frequently. Now, I did a video earlier about, doing our yearly physical. If you haven't watched that video, it's on YouTube. It's very, very good. It's trending. Please watch that video. When you go for your physical, the doctor will order some labs, and part of the labs you will see lab for your A1C, which is your cholesterol. This, if it goes high, and this cholesterol lab is not something you eat like maybe 1 month, that it's usually what you eat for 6 months that will show the result if your A1C is high. Most people with diabetes, their A1C is always high. So you want to consult your doctor so that way you can do your yearly physical. That's why I emphasize on yearly physical, to please do it. It's very, very important. If you haven't watched that video, I explain everything in there. Go watch it. It's on YouTube, please. Very educative. Okay, now let's go to prevention. How do we prevent diabetes from occurring? Okay, number 1, healthy diet. I can't stress this enough. I always say it. Whatever we garbage in our mouth is whatever we have. If you have not been eating healthy, this is the time that you need to eat healthy in order not to have diabetes. And if you already have diabetes, you still need to eat healthy. Low carb. Reduce sugar. There are substitutes for sugar. You don't have to even, like sweet. We have sweeteners. I'm not going to mention sweetener. I'm not advertising any sweetener, but there are some alternative. Instead of using sugar, there are some alternatives. And if you're a diabetes person, sugar is the no-no. Instead, they will tell you to use sweetener, or if you have to drink, all this soda, they will tell you diet or 0 calorie, but they are not even recommending that. They will tell you to stay away, okay, from meat. Instead of eating white rice, they will tell you to eat brown rice. Instead of frying your food, they will tell you to eat baked food, or preferable hair fryer. Instead of using seasoner, they will tell you there's an alternative one. Just check label. This is where you check label. Okay, I will now go back to part 2. Let's go back to part 2. Okay, see you guys. Turn on the notification. Go to part 2. Let's do part 2. Okay.